Okay. So if you were to come into the clinic and you were going to ask me about Strattera to see if there was any side effects going on, I would walk you through the side effects just like this. We're going to jump over to drugs.com. Under drugs.com for Strattera or really any medication, put the medication in, find that medication, find the gold star, go under the side effects tab, and you're going to get this page. And up top, there's going to be a lot of common for the consumer type side effects, more simple wording. This black box warning if there are black warnings on the medication. And then scroll down a little bit, and there's an area for healthcare professionals. And this is the area that I use a lot, really just because it gives us a lot of percentages. And that's what we're going to go through here today. Back over to my slides here. Quick mechanism of action here for Strattera. It is not a stimulant. Acts similar to stimulants. On the left side is a representation of stimulants. Let's blow that up a little bigger. Stimulants block norepinephrine and dopamine transport pumps. You see that on the left. On the right, it's just the norepinephrine reuptake pumps. So we think that Strattera or Atomoxetine is primarily only really affecting norepinephrine. With that in mind, norepinephrine is the primary neurotransmitter that are in stimulants, or one of them. And you can expect a lot of side effects similar to other stimulants for that reason, though. Let's start off with the very common side effects. And on drugs.com, or if you go down to that for healthcare professionals spot, very common is considered anything 10% or more, meaning at least 10% of the time, or if you're going to get a side effect, anything greater than 10% is labeled as very common. Dry mouth is the most common. I went through the profile earlier. 35% is the highest percentage as far as a side effect. That's over a quarter, over a third of people experience dry mouth with this medication. But there's also nausea, there's abdominal pain, there's constipation. Constipation's I see quite frequently, actually. Vomiting, there's increased heart rate, increased blood pressure. That's why those are monitored so heavily when you're on a medication like this or a stimulant. There's headaches, insomnia, hyperhidrosis. Hyperhidrosis is sweating all the time. Insomnia makes sense. We're increasing that norepinephrine neurochemical. Some people just don't sleep with it at all. But then you see two of them there, sedation and fatigue. The sedation up to 11% in people. And this is one of them I really didn't quite know if this was, if they were mentioning this as a side effect. For many people that have ADHD, they'll have a calming effect when they take stimulants or when they take Strattera. So I don't know if that sedation is a kind of like a expected side effect if you are somebody who's appropriately diagnosed with ADHD or not. I don't know. We'll have to see if Allie has any comment on that one. But then there's the rare or serious side effects, and these are the ones that nobody wants to have happen, but they do happen, and they are labeled less than 0.1% of the time, or somewhere between 1 in 1,000 and 1 in 10,000. So pretty darn uncommon. Raynaud's phenomenon, not super serious, but just rare. Raynaud's phenomenon is where the blood vessels don't really act appropriately. Every once in a while, you'll see somebody with super blue fingertips or super white fingertips. It's because their blood vessels aren't acting quite right. That one can be caused from Strattera. Peripheral vascular instability. So with a lot of medications, People will get a positional related dizziness or positional related vertigo. Head movements, getting from a seated to a standing position too quickly will make people lightheaded. That's like a mild side effect. Peripheral vascular instability, you're talking about significant blood pressure instability that waxes and wanes, fluctuates dramatically to the point where it can even cause organ damage because it's not perfusing enough blood to those organs. I've never heard or seen something that potent from this medicine, but it is labeled as a rare side effect. Liver failure, hepatitis, increased LFTs, liver function tests, all super rare. Another thing I have not seen with stimulants or with Stratera specifically, but I also know that it's labeled under stimulants. There's a few things that were frequency not known. So MI, myocardial infarction or heart attack, strokes, panic attacks, akathisia were all labeled under frequency not known. This means that there was some sort of a relationship that was developed within a certain time period of taking the medication. These events happened, but it's so infrequent or rare that they can't even put a number to it. But it's still worth mentioning and putting up there as a potential risk for people. Other serious side effects that actually aren't considered rare, again, rare being less than 0.1% of the time, seizures were labeled between 0.1 and 1%, so somewhere between 1 in 100 and 1 in 1,000 patients. Something to keep in mind. Although I don't think that would be, I still don't think, I've never come across anybody with a seizure from Strattera. I've come across a handful of people that have had a seizure from Wellbutrin. So I think the risk for seizure from that is really still pretty darn low. One that I would be worried about is priapism. That also happens between 1 in 100 to 1 in 1,000. So somewhere between 0.1 and 1% of the time. Priapism being a painful, long erection that actually can put certain parts of a man in jeopardy if it goes on for too long. So something to always be aware of. And then they labeled male pelvic pain. The same thing, somewhere between 1 in 100, 1 in 1,000 patients that might experience this. I particularly put this one up, not necessarily because that one's so serious, but because I do seem to come across a lot of patients with a lot of random, non-specific type pains, and this isn't just Strattera, this is just medications in general that have a very close correlation to starting certain medications. And they actually label male pelvic pain in this one. Whenever somebody has weird, isolated, maybe even long-term pains that really just kind of seemingly popped up out of nowhere, you might want to go back and rethink about any of the medications that you're on. When did you start them? When did your body pain start? That one kind of speaks to me. I've come across that a handful of times where I seriously considered some new medications people were on. Strattera, they actually had it labeled. So QT prolongation, anytime that you hear QT prolongation, think about the heart rhythm. It's really a measurement of the ventricular electrical activity. When that QT interval gets longer and longer and longer, it can become a serious medical concern. Big picture speaking, QT prolongation, there's a lot of medications that can prolong the QT interval. And as long as it is monitored, especially if you're on a lot of QT prolonging medications, usually not a significant concern. There is a black box warning for Strattera. Suicidal ideation in children and adolescents. It does seem to have a increased risk when first starting these medications. So and then it labels out their concerns about suicidal ideation and getting help. This is one of those things that the pharmacists stress whenever there's a black box warning. Almost everybody will get told the black box warning by the pharmacist when you go to pick it up. And then there's many more, because I've really just picked out the very common, again, greater than 10%, and the rare but more serious ones. But if we jump back over to the drugs.com here, again, there's tons of symptoms. So if you started Stratera, or your children started Stratera, and there's just a little bit something different or off about them, come to this page, look through all the side effects. Actually, now that I'm back on this page, I missed metabolic, decreased appetite up to 24%, which makes sense. That's a common side effect. But again, there's a lot of common, uncommon type side effects that are listed here. Please take your time and go through that if you have more concerns or questions, because that's what I do. If there's a funny side effect that a patient thinks that they might be having, or a funny symptom that they're coming and presenting with, and there's a close correlation of when they started a medication, I jump to this page to see the likelihood of what the reality is that the medication is causing what's going on. Jump over to some comments and questions here real quick. I think it's pronounced Bashel. Perfect timing. Start this medication tomorrow. Wanted to mention with the insurance, it was going to cost $81 versus $30 with GutRx. Any time that I get an opportunity to mention that to people, definitely always consider GutRx. The insurance game with pharmaceutical companies and large payers and everything, it's all a big game. GoodRx helps you get the lowest cash price available. Many times, GoodRx will beat out insurance plans and whatever they negotiated with the third party payers. So always consider that one. The political analyst. This person started Stratera at 25 milligrams. Noticed that there was improvement in symptoms, but after a month or so, noticed that those improvements are actually waning away and going back to where they were previously. I don't know if it's a him or a her. But they did better. They had less daydreaming, less fidgeting. They were able to focus more, remain focused longer, even if you're bored. That speaks to me. But the symptoms seem to be waning, or the improvements seem to be waning away. Wondering if they should up their dose to 80 or even 100 milligrams. And the short answer is generally yes for adults. If you do seem to get, and they jump from 25 up to 60, and then wondering if they need to jump even higher to 80 or 100 milligrams. Broadly speaking, if you're not getting side effects, if a patient like that was in front of me, if you're not getting side effects and you are getting improvement with Stratera, you're seeing improvement with the inattention, the ability to focus is getting better, you're not forgetting things, not forgetting stuff on your calendar, you're not absent-minded, then the answer is to go up to that 80 to 100-ish range, somewhere where there's considered to be a more of what do I want to say? An effective dose where you're not going to lose benefit over time. And the reason that I'm kind of hemming and hawing at this is because Stratera is different. I didn't mention this at the beginning. Stratera is different than other stimulants. Other stimulants, true stimulants, you take the medication and it's going to work that day. Stratera is not like that because it's not a stimulant. It takes a minimum of 2 weeks, but generally 6 to 8 weeks before you really see the full effects of it. So it really acts more like an antidepressant. And because of that, you want to have an effective um, dose in your body. You don't want to be underdosing yourself in that case. Now, if you're climbing up the ladder, start low, go slow as far as increasing your milligrams. You just want to make sure that you're not starting to get all side effect and no benefit. That's all. But short answer, yes. Generally, I would continue to climb that ladder with the patient so long as they're not having side effects that are concerning. No, maybe I didn't have to cut out such a big screenshot of this one. BH had mentioned that they went to a neurologist, and the neurologist was treating their ADHD, but he wasn't totally excited about having the neurologist as an ADHD provider. He just took forever to trying to get into a psychiatrist or somebody who did specialize with ADHD. And then Dennis kind of seconded that. Get frustration with the medical system, and I feel that from my end because I as a family doctor, I don't want to misdiagnose anybody, but there's specialists for a reason, and if you are incorrectly or inappropriately diagnosed and then mismanaged because of that, you might not have the best outcome when a good outcome is definitely possible. Dennis was saying at the very end here that, with ADHD, it's not just that. It's not like you're just a 2-year-old bouncing off the walls. It is an actual cognitive process that is hard to make it function. Everybody thinks that you have anxiety, and ADHD, you're not just depressed, which is true. ADHD can cause you to be depressed. It's not like you're just manic or having manic issues. 100% true. I see that from time to time in an express care clinic, but certainly Allie sees it all the time, where the presenting symptom is either depression or anxiety. And after you fed her through a few details, you get on the track. Well, these people are underperforming, especially kids. They're constantly being told that they're not doing well. They're not doing well in school. Go clean up your room. They forgot. They're bounce around the house. They get yelled at by their parents a lot because of that. Well, yeah, I'd start being anxious and depressed too. So many times Allie will catch undiagnosed ADHD when the kid was previously diagnosed with anxiety and depression. We're treating the wrong thing. There are many, many kids that have significant anxiety issues that knock out their anxiety because all of a sudden they can focus when treated with a stimulant, because you're treating the ADHD, and the anxiety then ramps down. Anne was talking about starting atomoxetine 25 milligrams. She's 56 years old, for previously undiagnosed ADHD. Initially noticed some symptoms, side effects of nausea and decreased appetite. And then she checked back in 3 months later, upped it to 40 milligrams. Friends and family can tell that I'm on it. I think because I'm not so animated, a little more calm, a little more subdued, a little more appetite suppression, which is a good side effect for her, per her. Other than that, I really don't feel like it's helping the issues I needed to help. I'm kind of disappointed. I thought a higher dose would actually help for better focus, and I'm still forgetting things and losing things, etc. I don't want to go on a stimulant medication. Two thoughts there when I saw that. Number one is 40 milligrams is still pretty underdosed for an adult. So you can definitely go higher with that. And then number two, sometimes we do run into patients where the Stratera is just not enough, and we gotta bump that up to an actual stimulant that is more potent. Strattera is very effective for ADHD, but it is still inferior to the potency of a stimulant. So sometimes you have to do that. If you're looking to knock out those symptoms of ADHD, especially if they're having a pathologic effect in your life. Jennifer is saying, is it safe to use with young ages for ADHD? Yes, absolutely. There's many people that actually prefer to use Stratera, many providers even that prefer to use Stratera because it's not straight up potent stimulant. Safe being relative, it depends depends what perspective or lens you're coming through, because clearly we're talking about side effects in this video. But safe is it's pretty relatively safe. I would certainly be comfortable putting my kid on it if need be. And then Gerard here was saying, thanks for the video. I'm currently starting on stimulants, but they're not really working that well to help control symptoms. I'm working with my psychiatrist to titrate and see if that may help. Knowing more about the non-stimulants as a fallback option is good. So thanks again. When I read this one, it is, I thought about the diagnosis. Is the diagnosis right on that one? Because stimulants can be, sometimes you got to play around with them. Some stimulants are better for some patients, and some stimulants not so good for patients. But if you've gone through the gambit of stimulants and you're not getting any effect of control of symptoms, side effects aside, if you're not controlling symptoms at all, then you have to kind of reconsider what the diagnosis truly is. And again, stimulants are more effective, more potent than medications like Strattera. So you should have seen some sort of controlled symptom, maybe side effect with that, but controlling some symptoms along the way. Just a thought there. But that's me making a comment with not a whole lot of additional information there. Next week, I'm going to go through the Concerta side effects. So leave comments or questions if you have any specific questions about Concerta. I'm looking over at the live comments real quick. Shannon Lee was saying that he got a choice between this medication, Strattera or Concerta, and don't know what to do. Admittedly, I don't know what to do either. But really, when it comes down to it, assuming that diagnosis is right and options laid out there for you, then it starts with trial and error and understanding the benefits and the risks, and start low and go slow. Todd, here, let's switch over to this one. Todd Riesland was saying, is there any natural root or herb without the side effects to do the same thing that this med does? Mechanism of action wise, no, not that I know of, but we do have quite a few videos on omega-3s and fish oil supplementation for ADHD. Actually, quite a, even before we made these videos, I was actually not really aware of how effective fish oil could be for ADHD. Is it going to be the full-blown stimulant? No, it's not. But there are a lot of benefits that we were seeing with the studies that were made with fish oils and omega-3s and certain ratios of omega-3s and 6s. So yeah, we got 3 videos on that, I think, so far. And I think we have one other one that's scheduled to come out in another, maybe this week. I don't know. I got to look at that. I think that's everything as far as questions there. But yeah, if you have any questions specific to Concerta and side effects, or just questions in general, leave them in the comments, and we will see you next week.